Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, today in this video we will discuss some questions from fundamentals of nursing. We will see the question one by one. The first question, for giving enema, height of enema can from ana should be. And the options are option A 15 centimeter, option B 25 centimeter, option C 30 centimeter, option D 45 centimeter. Our question is, for giving enema, the height of enema can from ana should be. That is the question. Among this option D 45 centimeter is the correct answer. Okay. For cleansing enema, in cleansing enema, the height of enema can should not be 18 inches or 45 centimeter. In case of normal cleansing enema, the height of enema can should not be above 18 inches or 45 centimeter. If it is 18 inches means that is the correct answer. Okay, in inches, 18 inches or 45 centimeter. And in case of retained enema or retention enema, the height of enema can should not be 8 inches or 20 centimeter. Purpose of this height is, the higher the container, how much height we are keeping the container, the higher is the force with which solution flow into the rectum. Okay, so the height of enema can, in case of this cleansing enema, it should be not above 18 inches or 45 centimeter. In case of retention enema, it should not be above 8 inches or 20 centimeter. Okay, here normally it is given for height of enema. So answer is 45 centimeter, option D. The next question, second question, endoscopic catheters are sterilized by. Options are option A autoclaving, option B hot air oven, option C 2% glutaraldehyde and option D boiling. Question is, endoscopic catheters are sterilized by option C 2% glutaraldehyde is the correct answer. These endoscopic catheters are sterilized by 2% glutaraldehyde, and also this 2% glutaraldehyde is used for the sterilization of cystoscope. Rubber catheters are sterilized by using 2% glutaraldehyde. Okay, here correct answer is option C is the correct answer. We will see the next question. Third question, most reliable method of measuring body temperature is. And the options are option A oral, option B axillary, option C rectal and option D elbow. Here, which is the most accurate or most reliable method of measuring temperature? The most reliable method of taking temperature is a rectal method. Option C is the correct answer. And the most convenient method of taking temperature is axillary method. Okay, and least reliable method also axillary method, and most commonly used method of taking temperature is oral. Okay, here most reliable method is rectal method, most convenient method is axillary, and most commonly used method is oral, and reliable least reliable method is axillary. Okay, here option C rectal is the correct answer. Fourth question, in children the calculation of drug dose is done on the basis of, and the options are option A age, option B weight, option C height and option D length. Here question is, in children calculation of drug dosage is mainly on the basis of weight. Okay, drug dose calculation for children is best done by considering the weight of the child. Okay, option B is the correct answer. And we'll see fifth question, intra-osseous injection is given in. Options are option A vein, option B bone marrow, option C spinal cavity, option D muscles. Here intra-osseous injection. Intra-osseous injection means when the drug or fluid is introduced into the bone marrow. it is called intraosseous injection. So answer option B, bone marrow, is the correct answer. So here when drug or fluid is introduced or injected into the bone marrow is called intraosseous injection. If it is in the vein means intravenous. If it is in the spinal cavity means intrathecal. Okay, intrathecal or intraspinal is same. And if it is in muscles means intramuscular. Here option B, bone marrow, is the correct answer. And we'll see next question. Sixth question. Kneechest position is also known as. Options are option A, left lateral position, option B, lithotomy position, option C, genupectoral position, and option D, Fowler's position. Here question is Kneechest position is also known as option C, genupectoral position. Genupectoral position or Kneechest position. This position is mainly used for the examination of rectum and vagina and as an exercise for postpartum patient. Mainly the examination of rectum in case of sigmoidoscopy and also in examination of vagina and as an exercise for postpartum patient. Okay, this position, Kneechest position, is also known as genupectoral position. And we'll see the next question. Seventh question. What is the correct sequence of 5 stages of dying? Options A, anger, depression, bargaining, denial and acceptance. Option B, denial, anger, bargaining, depression and acceptance. Option C, denial, depression, acceptance, bargaining and anger. Option D, depression, denial, anger, bargaining and acceptance. Here the correct sequence of stages of dying is denial, anger. First is denial, then anger, then bargaining, then depression and finally acceptance. Denial, anger, bargaining, depression and acceptance is the correct order. Option B. Next question, eighth question. In a healthy person, stroke volume is about. Options are option A 50 ml, option B 100 ml, option C 70 ml, option D 170 ml. Here, in a normal person, the normal stroke volume, in a healthy person, the normal stroke volume is about 70 ml. Option C is the correct answer. The stroke volume means the volume of blood pumped out of the left ventricle during each systolic contraction is called a stroke volume. The formula for stroke volume is equal to N diastolic volume minus N systolic volume. That is called a stroke volume. Ninth question. Catgut is a. Options are option A, synthetic absorbable suture, option B, synthetic non-absorbable suture, option C, natural absorbable suture, option D, natural non-absorbable suture. So here Catgut is an example of option C, natural absorbable suture. Catgut is a natural absorbable suture. Option C is the correct answer. And we'll see the next question, 10th question. Which of the following drug is the choice of treatment in drug-induced anaphylactic shock? Okay, and options are option A, dopamine, option B, adrenaline, option C, digoxin, option D, protamine sulfate. Here the question is which drug is the drug of choice of treatment for the anaphylactic shock? We all know adrenaline is the correct answer, option B. So adrenaline or epinephrine is the drug of choice in the anaphylactic shock. Option B is the correct answer, adrenaline or epinephrine. Okay, option B is the correct answer. 11th question. In following, which bone is generally preferred for bone marrow aspiration? And our options are option A, iliac crest, option B, humerus, option C, femur, option D, tibia and fibula. Our question is which bone is generally preferred for bone marrow aspiration. That is the question. Here answer will come option A, iliac crust is the correct answer. Usually this bone marrow aspiration is doing in sternum, iliac crust, posterior superior iliac spine. Okay, and in case of in children, tibial puncture is most commonly doing. Okay, children's up to the age of 2 years, proximal end of tibia just below the tibial condyle and medial to the tibial tuberosity is selected in case of children. Okay, so in case of children, once again I am telling, in children up to the age of 2 years, the proximal end of tibia just below the tibial condyle and medial to the tibial tuberosity is selected. If the children older than 2 years, that is if the older children, the iliac crust is usually the selected site for older children, and the most preferred site is also iliac crust. Okay, here our question answer is option A, iliac crust is the correct answer. 12th question, substances used to counteract effect of poison is, and the options are option A, antibiotic, option B, androgen, option C, antidotes, option D, antiemetic. Here question is substances used to counteract, used to give against poison is antidote. Option C is the correct answer. Antidote are the substance which is used to counteract the effect of poison, or which is used to give against poisonous substance are called antidote. Option C is the correct answer. And the next question, drug used to cause intestinal evacuation is, options are option A, cathartics, option B, carminatives, option C, astringents, option D, antimycotics. Here, drug used to cause intestinal evacuation is called cathartics. Okay, cathartics are the drug used to cause intestinal evacuation. Okay, they are again divided into laxatives, purgatives, drastics and hydrangeas. This cathartics are divided into laxatives, purgatives, drastics and hydrangeas. Okay, here option A is the correct answer. 14th question, which of the following positions should be provided to the patient during sigmoidoscopy? And the options are option A, lithotomy, option B, Kneechest position, option C, supine position, option D, all of this. Here question is which position is usually given during sigmoidoscopy. That is the question. Here correct answer is option B, Kneechest position. So in the previous question we already saw, that is for examination of rectum, that is sigmoidoscopy, and vaginal examination, and as an exercise for postpartum patient, all we are providing Kneechest position. It is also known as genupectoral position. Okay, so here answer is option B. And the next question, 15th question, a drug used to increase the amount of secretion of bile is, and the options are option A, biologicals, option B, catharatics, option C, cholangios, option D, caustics. So correct answer for this question is option C, cholangios. So here the drugs which are supposed to increase the amount of bile secretion is called cholangios. So here option C, cholangios is the correct answer.